Did Shawn Baker, the carnivore influencer, lose his medical license? I'm Dr. Eric Westman, and welcome back to Dr. Westman Reacts. If you don't have my top 10 tips on how to start keto right, look in the description below. Now, I've met Dr. Shawn Baker on several occasions, and he is a tall, muscly orthopedic surgeon who I guess is a retired orthopedic surgeon, since now he's doing nutrition education. But he's known as one of the doctors who has followed and promotes a carnivore type of diet. He has a book on the carnivore diet as well. You can't go see him as a patient, but he's teaching through the internet, through a company, and has a lot of experience with other people doing carnivore diets as well. We're still waiting for the high-level clinical research, prospective clinical trials on the carnivore diet. In my practice, I teach an approach that emphasizes protein, meaning the meat, poultry, fish, and shellfish and eggs, but it's not strictly carnivore. I do allow for some leafy greens and some non-starchy vegetables. That's the studies that we've done have included those. So our studies really weren't just on the carnivore diet, but I suppose it's carnivore-like or very close. Remember, carnivore is just a sub-diet underneath the family of low-carb diets that just excludes the vegetable matter. Dr. Baker goes into detail on his background in this interview of him. Let's listen in.
Like I said, if I was in it for financial reasons, I would have never gone here. I mean, it's one of those things where, I have an active medical license. I can go back and practice medicine any day if I want. I don't want to do that.
Well, I was going to say, she was struck off in 2017, but that was overturned in 2019, if I've got my dates correct. But there's no desire for you to go back into that profession? No.
I mean, I have, one of the things, when I went through that whole sort of thing with the hospital is I was incredibly naive in my thought of how medicine worked. I thought, you do the right thing and you're rewarded for that. And what I found out very painfully was that, if you're advocating for health and lifestyle and it's impacting the bottom line of a corporation or a hospital and they're losing money, they're not interested in that. And that's the whole crux here. And so I didn't want to go back to that. I don't want to go back.
So is that why you were struck off? Sorry to jump in, but for a little bit of context there for people that might not understand, what was the situation?
So this is really going back to like 2015, I think. And so I was a head of orthopedics at a hospital. I was incredibly busy. The hospital, really liked what I was doing. They put me on billboards, put me on radio shows, promoted the hell out of me. I was their golden boy, more or less. I was doing more surgeries than anybody in the whole hospital. And then I had the audacity to start playing with my own diet and figuring out that how it helped me. And then I started to, approach patients with making dietary shifts, purely for the reason so I could do a surgery on them because they were obese and we wanted them to lose surgery so they would have less complications.
And that's a very common thing today. So I have lots of referrals at my Duke clinic from orthopedic surgeons, people who are wanting to do more operations. And so also the outcomes are better if people lose weight before the knee replacement or hip replacement. And then a doctor visited me from Sydney, Australia, an orthopedic surgeon, just like Dr. Baker, and told me that he didn't have to operate on as many people. About a third of the people that he was going to make knee or hip replacements on didn't need the hip replacement or knee replacement anymore. And he was okay with that, but it did reduce the number of operations he did. And it's the same thing that happened to Dr. Baker.
And so what I started to notice, however, was many times, even in the absence of any significant weight loss, their pain would go away. So the reason for surgery would go away. I had people that were scheduling, I'm going to replace your knee in 6 weeks. We got to get you to lose 20 pounds, blah, blah, blah. And they come back 2 weeks later and, hey, my knee doesn't hurt anymore. And I'm like, well, that's weird. Well, if your knee doesn't hurt, we're not doing surgery on you. So I started canceling surgeries. And then as I saw more and more, I said, hey, there's something here. Maybe we can have these people avoid these really, big procedures that have potentials for complications. And I approached the hospital administration and said, hey guys, I would like to spend, half a day a week just, counseling patients on lifestyle stuff. And they said, that's a good thought, but no, we don't want you to do that. And to me, I was like, that's really strange.
Well, I have to echo that even at a university hospital and clinic practice that I'm in, it's the surgical procedures and other kinds of procedures that make money, the most money. Even transplants are a big profit center. So I can see that if he's going to his powers that be, who are in charge of his salary and the hospital bottom line, they're not going to want him to take half day out of the operating room and teach people how not to have operations, because that's not where the money comes from. But it might make people better. But the harsh reality, and I think it's true, having met Dr. Baker, that I think he was just kind of naive and well-intentioned and didn't realize that it would get him into trouble by operating less.
And so I did it anyway. I went back and forth 6 months or something like that. And finally I said, screw it, I'm going to do it anyway. And then all of a sudden I get this, this so-called peer review thing, and they basically suspend my ability to practice because that's something you can do through peer review. Hospital peer review is a protected process. You have almost no rights during that process. I could not even see the data they were using to incriminate me with,
Yeah, he talks about that really fast, but that's a process that I go through. Every year we ask other of our peers to write letters about us, and hopefully they're positive. We do check and select people who we think will write us a good letter. But if you're now not in the favorable graces of the corporate people at whatever company or hospital in this case, they can actually influence that peer process. And there is no recourse. I suppose you could have a lawsuit to question it, but basically it is a process that's not open, not transparent, and if you're on the wrong side, this is why you play the politics at the hospital and at the clinic and at your company, because some of these processes are not like a legal ability to see everything and to have a fair and balanced sort of review of your work. So it looks like, in other words, he got blackballed.
And so I left the state medical license, said, hey, we've got a complaint from a hospital. What do you want to do about it? Do you want to contest this?
So in fact, the hospital filed a complaint with the medical board. Now, the medical boards in states have another sort of absolute power position, and I've been involved with reviewing other practices for the medical board, and really don't want someone to complain to the board, because the board will look into it and usually have an investigation into whatever is going on. So the hospital wasn't happy with his practice. They sent a note to the board, and the board contacts Dr. Baker.
And I said, well, what's the story on contesting? He said, well, you're going to have to wait about a year and a half because we're booked up and it's going to probably cost you $250,000. And I was like, well, that doesn't seem very good, And so I said, what is the other option? They said, well, if you go to this place, the centralized place where they can assess you, they can do an independent review on you. And I said, well, let me do that, because I knew I was fine. I didn't think I had any problem. So I go do an independent review, and they said, yeah, you're totally fine. There's nothing wrong with the way you practice. Go back to work. All right. And so, but that process took like 6 months for them to write the reports. And then when I submitted it back to the state medical board, they got it, and they said, okay, now we have to wait till our next meeting, which is like, 4 or 5 months later. And then they said, okay. And then they had to they said, you can apply for your license again. I had to apply, and then that took another 6 months. So all in all, it took like 2 years to resolve this thing. Even though, the decision to that I was fine was like within a few months, it took 2 years. And by that time I had already started doing all these other things. I was like, I'm not interested in that crap anymore. I'm happy where I'm at now. So that's it's a long drawn out thing, but that's the kind of the overview of that story. But, I hope that I never have to go back to operating on people again, because that would mean I failed in this new task, which I think is more valuable and more important, which I'm quite honestly, I think I'm honestly better at. I thought I was a pretty good surgeon, but I think I'm more better at what I do now. I think, what I do is kind of unique in a way. And I think I've got a skill set for this that, a lot of people have, just because of the experiences I've had, right? I mean, I've got the experiential knowledge and observation and maybe leadership qualities that put me in a role that I'm more better suited for. And so I'm discovering a little bit later in life that this is what my if you want to call it a calling, so to speak, this is where I'm at.
Interesting. And I have to echo that this process is one that can be subverted and influenced. He had to take a lot of time and money to repair the damage because he wanted to operate less on people and help people lose weight and have fewer operations. In my clinic, because I'm not a surgeon and I don't operate on people, it is a goal of mine to make it so that people don't need the operations. Even then, some people still need the operations. But fortunately, in my area, the orthopedic surgeons will refer to me, and still a subset of the folks will go to get the operations. So they're not keeping people away from me. They would rather have the people lose weight to have better outcomes after the operations. It's unusual to get a doctor to talk this plainly and frankly about this kind of process. He can do that now because he's out of the system. And I just have to also reflect that he told me that he's a champion rower for his age group. So I think he's also gotten into the bodybuilding and the all that athletic kind of stuff that helps him with his promotion of carnivore diets. But so trains as an orthopedic surgeon, now a nutrition scientist and promoter of the carnivore diet. I know it seems strange, but in other circles we see doctors who have fixed their own weight issues and then they become low-carb or keto doctors. There's a nephrologist in Toronto who got tired of dialyzing. Nephrologists are kidney specialists who do dialysis when the kidneys have failed, and he got tired of doing dialysis, so he became a writer and low-carb intermittent fasting guru. That's Dr. Jason Fung. So it's pretty common for doctors to come to a stage of life where they don't have the tools to fix people, or they see another way to fix themselves. Dr. Tro Kalayjian, low-carb MD, is a doctor who fixed his own health issues and now is teaching other doctors in a practice. So it doesn't surprise me that he had this kind of path. I didn't know the detail of how he was in hot water about the clinical practice, but I can see, and maybe with his personality, he decided, or a general surgeon personality, he didn't want to put up with that anymore, so he's moved on. And interesting to see that. I think his approach is legitimate. It's a valid approach. And I say that because some of my patients who have not been totally fixed by my approach have done a carnivore diet and actually got better. And the look at vitamins and nutrients on a carnivore diet seems to be adequate for humans. The problem is, and I hold back because we don't have high-level clinical trials to support its use. So the reason that's important is there may be small things that happen that you don't see in a sort of clinical use without systematic capture of all the people who are following it. You don't see everyone in the denominator. Of course, I've been reminded that even in clinical trials, you lose people to follow-up, so you don't have everyone at the end of the clinical trial. But still, I'm not super worried about this approach, especially if you're under medical supervision. Remember, if you're on medications or you have medical problems and you change to a diet like mine, keto or Dr. Baker's carnivore, you want to do it with medical supervision. And it's not because the diet is harmful, it's because the medications can become too strong very fast. I hope that's helpful, and if you don't have my top 10 tips on how to start keto right, look in the description below. Please like and subscribe so you don't miss out on future content. If you enjoyed this video, be sure to like, subscribe, and hit the notification bell, and check out adaptyourlifeacademy.com.